So guys, welcome to today's presentation. So today we are going to discuss about typhoid fever, which is also called enteric fever. So before we start, remember to like, share and subscribe to the channel so that you'll be notified each time we post a lesson on YouTube. Thank you. So we are looking at typhoid fever. So from this picture, we are able to see how it is transmitted. So it can be transmitted through ingestion of water, milk, or any food which is contaminated with the bacteria. Then when it enters into the GIT, it goes to the small intestines, ulcerate or perforate the intestines, and other signs and symptoms. So let's continue. So our general objective is that at the end of this lesson, the student should be able to acquire knowledge about typhoid fever and be able to manage /nurse a patient with enteric fever. So our specific objective are as follows. At the end of this lesson, the student should be able to define what typhoid fever is, state the causative organism of typhoid fever, state the mode of transmission. The student should be able to describe the pathophysiology of typhoid fever, should be able to state the signs and symptoms of typhoid fever, should be able to state or explain the medical management and the nursing management of a patient with typhoid fever. They should be able to state the complications and explain the prevention measures of typhoid fever. Sorry, it's not malaria, it's typhoid. Okay, so on the introduction, typhoid fever is a common cause of fever worldwide whenever sanitary conditions are poor, and it is particularly prevalent throughout the tropics. So in Africa, Salmonella type P is predominant, while paratyphoid A occurs in Eastern Europe, the United States, and the Far East. So on the epidemiology, typhoid fever is more common in children and in young adults. Then it is more prevalent in areas that are more overcrowded with poor access to good sanitation. It is common in Africa, China, India, Indonesia, Bangladesh, and the Latin American. So now, let's look at the definition of typhoid fever. So typhoid fever can be defined as an acute illness that affects the gastrointestinal tract. It is caused by a bacteria known as Salmonella typhi, which is transmitted through the oral fecal route. It is characterized by fevers which are in a ladder-like pattern. So it can also be defined as a bacterial infection of the intestinal tract and occasionally the bloodstream. It is caused by Salmonella typhi. So that's how we can define typhoid fever. So in simple terms, we are just saying it is a bacterial infection which is caused by a bacteria known as Salmonella typhi, which is transmitted through ingestion of contaminated food or water, and it is characterized by fevers which are in a ladder-like fashion, also abdominal discomfort, and general body weakness. So that's the other way that we can define typhoid fever. Just make sure that you notice the cause, what causes and how it is transmitted, and which part of the body it affects, and the signs and symptoms, to make sure that in case it comes in the exam, you are able to get the 5 marks. So you have to take note of all those points. So the causative organism of Salmonella typhi is the causative organism of typhoid fever is Salmonella typhi, which is a gram-negative flagellated anaerobic bacteria. So the mode of transmission is through the oral fecal route. So the transmission of typhoid fever is by ingestion of contaminated water or food. So anything which can be ingested and can be contaminated with the bacteria can be a mode of transmission. For example, milk, water, of course, then the food which is not adequately prepared. It can contain the bacteria. So now the incubation period is between 7 to 14 days. So now, having looked at that, let's move on to look at the pathophysiology of typhoid fever. So the portal entry is the GIT, which is the gastrointestinal tract. So when a typhoid bacilli enters through the GIT, of course, through ingestion, let's say someone has taken water or milk which has got thousands of the Salmonella bacteria. Now what happens is, in the stomach, we know that the stomach is acidic, and most bacteria do not survive in acidic conditions. So when the Salmonella typhi goes into the stomach, and if by chance it survives the acidic conditions of the stomach, it progresses and goes into the intestines. So what it does is it attaches. So the bacteria will attach themselves to the tips of the villi in the upper intestinal tract, to which they invade directly. So the bacteria enter the small intestines after surviving the acidic conditions of the stomach. Then they attach themselves to the villi, and we know that the villi are found in the intestines. So when they attach themselves to the villi, then they invade the rest of the intestine directly. So when these bacteria invade the mucosal layer, it causes ulceration and inflammation of the intestines. So we know that when the bacteria enter into the body, in this case we are talking about Salmonella typhi, it attaches itself to the villi, which is found in the intestines, then it invades, so it enters into the mucosal lining, of the intestines. So when it goes there, it will cause ulceration, and then inflammation starts to take place. So after that, it enters into the bloodstream. So when it enters into the bloodstream, at this point, the stool cultures may be positive for several days, then they become negative and positive again later in the course of the disease. So what we are saying is that the bacteria is in the intestines. It causes inflammation and ulceration in the mucosal lining of the intestines. Then when at this point, if the stool is collected, it may be positive. Then after some time, it may be negative. So the organisms pass through the intestinal lymph follicles and the mesenteric lymph glands via the systemic circulation to the liver and the spleen. So from the small intestines, the Salmonella typhi passes through the mesenteric region and the follicles by the bloodstream and goes to other organs such as the liver and the spleen. Others may even go to the heart because they are in the systemic circulation, and we know that the systemic circulation may in the end involve the entire body. So the bacteria will be able to move to other organs such as the spleen, the liver, heart, causing endocarditis, causing some hepatitis on the liver, and affecting other organs. So where they are filtered out by the reticular endothelial cells. So from there, the bacilli multiply in the mononuclear phagocytic cells of the lymph glands. So we see that now the bacteria start to multiply in different parts of the body. So the lymph, such as the lymph follicles and the liver and the spleen, but cause only slight changes in these organs, and there is no clinical features. So at this point, the bacteria has gone to the liver, to the spleen, and to other organs. The bacteria is present there, but the patient at this point is not showing any signs of infection. So that's what this means. So then the bacteria enters the bloodstream for the second time, and the infected person develops signs and symptoms. So we saw that from the start, the bacteria was in the intestines, where it attached itself to the villi, goes into the mucosal lining of the intestines, cause ulceration and inflammation. From there, it enters the blood through the systemic circulation, go to different parts of the body, such as the spleen and the liver, also passing through the mesenteric region. So at that point, the patient is not showing any signs of infection. So from there, it multiplies, the bacteria will multiply itself. When it multiplies itself after some time, it will now come back into the bloodstream the second time. Now at this time, a person will start to show the signs and symptoms of the disease. So in summary, the pathophysiology of enteric fever, we can put it in 3 stages. So first, the Salmonella typhi is in the drinking water or food. Then it enters into the small intestinal mucosa. So it has passed through the stomach. If it's lucky, if it survives the acidic conditions, it proceeds to the intestines. So now when it enters into the intestines, it causes ulceration and inflammation. From there, in the second stage, the bacteria will enter into the bloodstream through the systemic circulation and go to different parts of the body, such as the spleen, the liver, the mesenteric lymph nodes, and other parts of the body. So then in the third stage, we see that the bacteria, the Salmonella typhi, comes back in the blood now for the second time, causing septicemia, and the patient starts to show signs and symptoms of the disease. So now let's move on to look at the signs and symptoms of typhoid fever. So from this picture, we are able to see that this patient will start vomiting, will have some rosy spots on the chest, then patient will have some chills, sweating, fever, abdominal pains, diarrhea, constipation, muscle aches, and joint pains. So now let's look at the signs and symptoms in details. So the signs and symptoms of typhoid fevers occur in stages. So the typhoid fever is characterized by a slowly progressive fever as high as 40 degrees or 104 Fahrenheit. So the patient will have profuse sweating, gastritis, and non-blood diarrhea. Then less commonly, a patient may have some rash, which are rose-colored spots, may appear on the chest and on the abdomen. Then the cause, if it is untreated, if the disease is not treated, typhoid fever is divided into 4 individual stages, each lasting approximately a week. So when the disease progresses now, the signs and symptoms will start to show in stages, and each stage lasting for about a week. So in the first week, there is slowly rising temperature with relative bradycardia, both malaise, headache, and cough. So in the first week, the signs and symptoms are not severe. There may be epistaxis and abdominal pains. Also, leukopenia may be present with the relative lymphocytosis. So this can be noticed when the investigations are done, such as full blood count, to show the number of the white blood cells. So also blood cultures are positive for Salmonella typhi. So in the first week, blood can be collected for culture, and the bacteria can be isolated and identified. So in the first week, we are seeing that the signs and symptoms are not severe. When we go in the second week of the infection, the patient lies prostrated with high fever, which is around 40 degrees Celsius, and has bradycardia. So the fevers continue to be present, and they can even be increasing from 38 to 40. So the patient has got a classical fever pattern. So the patient may also be delirious. So delirium is frequent. Then the patient may look calm, but sometimes agitated. So this delirium gives a typhoid the nickname of nervous fever. So the rose spots may appear on the lower chest and abdomen. That's in the second week. Then the abdomen is distended and painful in the right lower quadrant. So the patient, the signs and symptoms now have started to advance or to become severe. So the patient who have abdominal pains which are located in the lower right quadrant. Then diarrhea may be present also, which can be green with a characteristic smell and comparable to pea stool. So at this point, the type of stool will be pea-like. Yeah. So that's in the second stage. Then constipation may also follow after having diarrhea. Constipation may come in. Then hepatosplenomegaly may also be present and tender. Remember that during the pathophysiology, the Salmonella typhi also went to the spleen and to the liver. So it means they may cause some inflammation in those parts. Then at this stage, the Wido test may come out positive. That's in the second stage. So let's just look at the second stage or in the second week. So we are saying that in the second week, the patient now have a high fever and also have a certain posture. Then delirium will be frequent, but the patient will look calm, but sometimes will be agitated. So there will be red spots which may appear on the lower chest and on the abdomen. Then the abdomen is distended and painful in the lower quadrant. So on physical examination, you see the patient guarding the lower part of the abdomen because of the pain that they are having. Then also diarrhea may be present and the stool will look like pea soup. Then after diarrhea, constipation may come in. Then hypersplenomegaly may be present and tender. Then at this stage, the Wido test may come out positive. So now, when the disease progresses in the third week of typhoid fever, a number of complications may occur. Remember that this infection is advancing. So intestinal hemorrhage can come about due to bleeding in the conjugated patches. So this is when the bacteria is in the intestines, and then because of the inflammation and destruction of the blood capillaries in that area, it may result into hemorrhage. Then intestinal perforation can occur in the distal ileum. You know that perforation will come about due to the ulceration and the inflammatory process occurring in the mucosa layer of the intestines. Then when this occurs, it is a very, very, very serious complication, and a patient may need to go for an operation. So when the intestinal perforation occurs in the distal area, it is a very serious complication which can be fatal. It may occur without alarming symptoms until septicemia or diffuse peritonitis sets in. So all these developments may be taking place and the patient may not show these signs until peritonitis occurs or septicemia occurs. So peritonitis, this is when it will occur when the intestines become so perforated such that the intestinal content now will start diffusing, coming out of the intestines in the peritoneum. So that will cause peritonitis, and a patient will need to undergo an operation in order to repair the damaged intestines or to remove the damaged parts of the intestines. So at this point, the blood cultures will still be positive, then fever will continue to rise, especially in the afternoon. Then encephalitis may also occur when the bacteria goes into the parts of the brain. Then cholecystitis, endocarditis, and otitis. So all these will come about as a complication of the disease. As the disease is advancing, complication may set in, such as cholecystitis and endocarditis. So this is when the bacteria now will start going to other parts of the body, causing disease and inflammation. So fever will still be very high, and then dehydration may also come about, because remember that at some point in the second stage or second week, the patient had diarrhea, so it may result into a patient having dehydration. So by the end of the third week, the fever will start reducing, and this carries on into the fourth and the final week. So now the disease has progressed. By the time it's fourth week, complications have set in and the fevers may start to reduce. If the disease is not treated, patient will have severe complications, as we will look at them as we continue. So now those are the signs and symptoms of typhoid fever according to the stages, which last for about a week. So now let's look at the medical management of typhoid fever, starting with investigations. So now, what can we do in order to diagnose a patient with typhoid fever? You may be a nurse in a rural health center, and you have received this patient having fevers, having abdominal pains, and showing the signs that we've talked about. What are you going to do? Or you can be at the hospital where you're working as a nurse. At least there you have doctors and clinicians who are able to diagnose. So let's look at the investigations that can be done in order to diagnose a typhoid fever. So first and foremost, we have to take history taking. So history taking will help us to see or to know if the patient is at risk of having typhoid fever, such as the age of the patient or patient traveling to an endemic area where there is typhoid fever. Then physical examination should review some signs and symptoms, such as the patient guarding the abdomen due to the pain that they are having. Then That's during the physical examination, you should be able to notice some signs and symptoms, while during history taking, you should be able to see or notice if the person is at risk of having fever. So if you are writing in an exam, you need to write properly investigations, underline number 1, you write history taking, underline explain now what history taking will do. Then next you go to physical examination, you explain also what you will do during physical examination, and you continue to list the other investigations. So blood culture. So make sure that blood culture will be collected in order for the bacteria to be cultured and isolated. Yeah, so blood culture we usually collect when the fevers are high, when the patient is having a fever, maybe 38, between 38 and 40. So blood culture is collected and the blood is taken to the laboratory. Then a full blood count will also be done. So a full blood count will be able to show an elevated white cell count. Then bone marrow culture can also be done in order to isolate the organism, the microorganism. There's stool culture of the bacilli. So we have to make sure that we also collect stool for microscopic culture and sensitivity. So as a nurse, your part is also to help the patient or to collect the stool sample from the patient and make sure that it's taken to the laboratory. So urine can also be collected for examination. Then the wide test is the confirmatory test of typhoid fever. So in this case, when the patient has typhoid fever, the wide test is going to be done and it should come out positive if the patient has got typhoid fever. So those are the investigations that we can do, that are done to diagnose typhoid fever. So just to go through them in short, or in summary, we said first we are going to do a history taking, which should alert us or to show us if the person is at risk of having typhoid fever, such as traveling to an endemic area, also the age of the child. Then second, physical examination should help us to see some signs and symptoms, such as maybe patient guarding their abdomen, or they're having bradycardia, or also the presence of fever. Then thirdly, we said the full blood count. Blood should be collected for full blood count, which will show that the white blood cells have been increased. Then we also collect blood for blood culture. So blood culture is usually collected when the temperatures are high. That's when you collect blood for culture. Then fifth, we also said stool from microscopic culture and sensitivities is also collected. Sixth, urine can also be collected for examination. Then the confirmatory investigations for typhoid fever is wide test. So if the patient has got typhoid fever, the wide test should come out positive. So those are the investigations that can be done. Others include an abdominal ultrasound, which can be done to show if the patient has got any perforations or any alterations going on in the GIT, in the small intestines, or the liver, or the spleen. So those are other investigations that can be done. So now let's move on to look at the medical management of typhoid fever. Now, because it is a bacteria, of course, it means you're going to use antibiotics. So antibiotics that can be used to treat typhoid fever as follows: ciprofloxacin or ciprobit. It can be used with a dose of 250 to 500 milligram 12 hourly. It can be given orally or intravenously. Then cefotriaxone can also be given according to the body weight. Then cefotriaxone can be given. Other antibiotics include cotrimoxazole, which is Septrin. It can also be given according to the body weight. Yeah, so in adults it will be 430 milligram to 960 milligram. It can be given BD or OD, and depending on how severe the infection is. Then other antibiotics include ampicillin can also be given. Then other medication which can be given are paracetamol for fever and abdominal pain. So antipyretics can also be given according to the severity of the disease or how severe the patient is in pain. So now those are some of the drugs that can be used to manage typhoid fever. So now let's move on to look at the nursing management. So our aims are as follows: 1, to treat the infection. Second, we want to isolate the patient and prevent the spread of the infection. Then third, we want to prevent the possible complications such as the intestinal perforations. We want to make sure that we avoid possible complication. Then if the patient is dehydrated, remember there was some diarrhea. So because of the inflammation in the GIT, the patient may have diarrhea, which can result into dehydration. So if the patient is dehydrated, we are going to administer fluids in order to replace the lost body fluids and electrolytes. So those are our aims. So if we are using a profenema, say we are in the exam, and then they've said we write the management. If it's not a nursing care plan, we can use the profenema. Now, if they have specified to say we write a nursing care plan, it means we have to identify the problems that this patient is going to have and how we are going to nurse the patient according to the problems that they may have. So that will be another topic that we'll have to look at if we are asked to write a nursing care plan. We will look at that. So for now, let's look at the nursing management. So first and foremost, we've talked about the aims. So when it comes to the environment, we have to make sure that the patient is isolated. Why are we isolating the patient? It's because we want to prevent the spread of the infections. Then we want to make sure that in the environment, all the necessary equipment are there to avoid moving up and down. So make sure that the vital signs chair is there, the emergency trolley is there, and all the things that we need are present in the room. So the patient is also nursed in isolation, which is also an infectious ward. So make sure that comes out. So when it comes to observations, we want to make sure that we monitor the vital signs. So we can do vital signs hourly. As we are observing the patient, we have to make sure that we are looking out for possible complications and report to the doctor. So as a nurse on duty, make sure that you are observing the patient, the condition of the patient. Is the patient responding to the treatment? And the doctors should be informed if the patient is progressing or not, so that necessary intervention are taken. So we can also observe for the stool. Remember we said that the stool appear to be like pea soup. So we want to make sure we observe the type of stool, the color, noting of the color, the amount and consistency. We also want to rule out bleeding in the GIT, which can be evident in the stool. So we are also we want to rule out GIT bleeding by monitoring the stool. We want to rule out bleeding. Then we also want to see if the color of the stool. So make sure that you observe that and record accordingly. Also observe the mucous membranes for signs of anemia, which may be due to the disease process. So during observations, there are a lot of things that you are observing for. You're observing for any signs of anemia, you're observing the mental condition of the patient. Are they delirious? Are they fully conscious? So make sure you are observing for that. So it should come out in your nursing care. So when it comes to psychological care, make sure that you explain the condition and the disease process to the patient and the family members. So this is important because it will reduce anxiety and it will also help the family members and the patient to learn more about the disease. So make sure that you introduce yourself to the family and to the patient to gain cooperation. Then explain any procedure which has to be done on the patient before doing it to promote understanding and cooperation. Then listen to patient fears and anxieties, and then reassure the patient accordingly. So be there for the patient. Listen to them. If they have any questions, let them ask freely and then respond to the questions accordingly. So also under psychological care, make sure you involve the relative in the patient care to prevent social isolation, keeping in mind that we don't want the infection to spread. So when it comes to nutrition wise, remember at first we said that the patient may be dehydrated. So if the patient is dehydrated, we are going to manage the patient accordingly. We are going to manage the patient according to the level of dehydration. So fluids that can be administered to this patient, fluids like half-strength Darus can be given to the patient or Linger's lactate, which can be administered at 40 ml per kg body weight. So 40 ml per kg body weight can be given to the patient to run in 30 to 45 minutes. Then 60 ml per kg body weight can be administered to run in 2 hours. So that's according to the level of dehydration. Then we also give ORS if the patient is able to tolerate it already. Then when it comes to feeds, give the patient light meal, a light diet. Remember that the GIT is inflamed and so it's not functioning the way it's supposed to function. So we want to make sure that we give light diet so that the patient does not to miss out on the proper nutrition. So make sure that the adequate fluids are administered accordingly. Then if there is any food which has been left, the leftover food should be wrapped and discarded or incinerated appropriately. So this is to avoid the transmission of the disease. So when it comes to elimination, remember that we have said that this condition is infectious. It is through oral-fecal route. If the stool of the patient is not appropriately disinfected before being discarded, it may be a source of infection to others. So we want to make sure that balancing is carried out and making sure that the enteric precautions or isolation are followed. Then stand urine and stool in disinfectant for 30 minutes to 1 hour before disposal. So we want to make sure that everything the patient has used has to be disinfected. If it's a bedpan, if it's the urinal, the linen, everything the patient has used should be disinfected for 30 to 1 hour before disposal. So we are doing all these things to prevent the spread of the infection. So make sure that the gloves and gowns are used appropriately and discarded accordingly after use. Then proper hand washing technique must be observed and followed to prevent the disease from spreading to other patients. Then soiled linen must be handled properly and must not be mixed with other linen. So we want to prevent the spread of the infection, and that's what we must do. Isolate anything the patient that has used, including the linen, the utensils. All these should be disinfected to prevent the spread of the disease. So when it comes to hygiene, patient may be given a bed bath, an assisted bath according to how the severity of the disease. Then oral care can also be done to prevent halitosis and any mouth infections. So these are the points plus others that we know about when it comes to the nursing care. So now let's look at the complications of typhoid fever. So the complication of typhoid fever, as we saw from the signs and symptoms, that the disease is slowly progressing, and because it uses the systemic circulation, which means the bacteria can go to different parts of the body and can cause infection in those parts. So it can cause typhoid meningitis, especially in children under the age of 5, due to the toxins and the bacteria reaching the meninges. So because of the systemic circulation, the bacteria are moving through the blood to the brain in the meninges. As a result, the children may have meningitis, or any adult patient. If the disease is not properly and appropriately managed, it can progress to meningitis. Then we have hemolytic anemia, which is due to an autoimmune phenomenon or complexes happening. So peripheral neuropathy can also come about due to the effect of toxins on the peripheral nerves. So in case the patient suffers peripheral neuropathy, it can be treated by the use of paradoxine, which is vitamin B6. Other complications includes proteinuria. This could happen due to the immune complex mediated glomerulonephritis, which may be present as renal failure or in nephrotic syndrome. So during the pathophysiology, we said the bacteria is in the blood, which is causing septicemia. So because it's moving all over the body, it can also go to the kidneys and cause glomerulonephritis, which can result into the kidneys not performing well and causing infection and inflammation to the glomerulus in the kidney. And this can be evident in the urine, that there can be proteins in the urine, and this can be detected by performing a urine analysis. So during the investigations, that's why we said that urine should also be collected for urinalysis or urine for microscopic culture and sensitivity. In toxic crisis resulting in the central and peripheral circulatory with mental confusion due to a large scale of lymphoid bacilli and release of large amounts of typhoid endotoxins. So because the bacteria is present in the body, it's also producing toxins, and these toxins, when they reach the brain, they may cause mental confusion. And as we talked about the signs and symptoms, the patient may also be delirious. So all that is because of the endotoxins produced by the bacteria. So now, how can we prevent typhoid fever? So first and foremost, it's to make sure that the food is well prepared and well covered before consumption. Making sure that the fruits are washed thoroughly before eating. Food must be fully cooked, then covered to prevent contamination. Then drinking water must be adequately boiled to kill any bacilli if present. Then cardiacs must be identified and fully treated. Remember the story of Mary Typhoid, who was a carrier of typhoid fever. So she was transmitting the disease. She was spreading the disease unknowingly. So it's possible to have carriers of typhoid. So those have to be identified and treated accordingly to prevent the spread of the infection. So also making sure that adequate treatment is done for these patients. If they are outpatient patients, emphasize the importance of drug compliance so that they are fully treated from the infection. So this is where our presentation ends. So any questions and contributions on typhoid fever are welcome. So in the next lesson, we are going to look at the nursing care plan of a patient with enteric fever. So remember to like, subscribe, and share. Thank you for listening. Enjoy your studies.